All right. So welcome everyone. My name is Leopoldo Cavazza. As many of you know, I am the co-director along with Byron Powell of the Center for Mental Services Research. And we're very excited to start our CMHSR series this year with a great talk that I've been looking forward to with Dr. MarySue Heilemann, a professor and Senate faculty chair from the UCLA School of Nursing, and actually the director also of the UCLA National Clinician Scholars Program. This is part of this talk today, and I'll give a little bit more of an introduction of Dr. Heilemann's work. But this talk is being co-sponsored by the Center for Race, Ethnicity, and Equity, and our Latinx Collaborative on Mental Health Stigma, Mental Health Literacy and Stigma that we have here at Washington University. So we're very excited to start this series off with today's talk, which actually has a great title. Damn, I'm not alone. I can actually get help catalyzing Latinas to pursue needed mental health care through transmedia storytelling. Dr. Heilemann has devoted her scientific career to Latinas' mental health and resilience. Since traditional approaches for engaging symptomatic Latinas in mental health treatment are limited in their reach, effectiveness, and appeal, Dr. Heilemann's team have acted on input from Latina parents, patients, research participants to explore the potential scalable web-based media interventions to address these inequities in care. This work is partnering with Latinx directors, screenwriters, and actors, plus editors, digital technology experts to create a Hollywood quality transmedia storytelling web-based app, which is going to be talking about today, called Catalina, Confronting My Emotions, Enfrentando Mis Emociones. And in addition to featuring a relatable lead Latina character, this app has bonus videos that feature evidence-based informed Latina nurse therapy character and provides information also on how to improve access to care. So we're very excited. I learned about this work through some of the work that we've been doing in improving access to care for Latinos in the United States. And this is really pushing the envelope on bringing the best available science as well as technology and media to address this major problem. So we're looking forward to MarySue's talk, and we're happy to have you here, at least virtually. So we're looking forward to your talk, MarySue, so you can take it away. Yeah.
Thank you so much, Leo. And I'm going to go ahead and screen share if everyone's okay with that. All right. And let me put this. So yeah, that title, I couldn't resist. This was a line in some qualitative work that we did, and just couldn't resist putting it in there. First and foremost, I just have to thank, Dr. Leo Cavazza for inviting me. I have long been inspired by your work, Leo, as you know, and your team's work, just phenomenal and incredibly inspiring and really breaking ground where no one else had. I think I'm pretty much preaching to the choir when I share this background information with you, but I am putting my obligatory background information here to give you a sense of what I see and what is the stuff that motivated me to, and my team, to create what we have created. Excuse me. So what I'm going to do is I'm going to give you a little bit of background, and then I'm going to share with you what we did and why we did it. And then along the way, I'm going to share with you some of the methodology that guided us along the path, because that was the big black hole that I ran into. Like, how do I do this? And then also more results along the way. But as we all know, starting off with the background here, oh, and I should say, of course, I'll stop in time so that we can have question and answers. And then, of course, Dr. Cavazza might jump in if I forget something. So welcome.
Of course, that's right. That's right.
All right, terrific. So we know, and I, as a nurse, as a public health nurse, as a labor and delivery nurse, as a home visiting maternity nurse, I learned a lot about mental health from just doing general visits with my patients. I've always worked with Latino women because of my background and language ability. And, we know that, of course, Americans overall delay getting health care for mental health. but it's especially crucial for Latinxes and higher for women than men worldwide. We know it's almost twice as high for women, Latina women, to struggle with depression compared to men. And then this work by Coe et al. Is so alarming that 68% of the Latina women in their sample of over 9,000 US women who met criteria for past year major depressive episode went undiagnosed. That's just staggering. And when you think of how debilitating depression can be and how highly comorbid it is with anxiety, you if you're me, you get the sense of like, this is where I want to try to make a difference in the world. Oops, let's see, how do I do this? Okay, so what I dove in and tried to do was, first of all, get a sense for where Latinas were at. You know, my original work was a qualitative work as a doctoral student after working as a nurse for 7 years in various Latinx communities in the Midwest, in Boston, and in the San Francisco, San Jose areas. And I dove into research. I wanted to understand depression and anxiety in relation to strengths like resilience, mastery, life satisfaction. And that's really thanks to some amazing mentors that I have. I did all of my graduate work up at UCSF in San Francisco. And of course, I wanted to understand how depression experiences, how people were experiencing depression and why, and what women gave as the reasons for why they were feeling depressed. I also did research looking into what types of sources Latina women found acceptable and that they were actually using and willing to tell us about in research, and also barriers that were holding women back. Of course, I knew from the literature that there's provider mistrust, but was able to go deeper with that with members of my team, looking at how provider mistrust is a profound barrier for a lot of people, and especially so when you're looking at folks who are dealing with not just depression and anxiety, but also diabetes or obesity or sleep disturbances or trauma. And we know that trauma histories can also make people very fearful of getting help. I did also some work looking at what women said were their motivations to actually take the step to enter therapy. And finally, I got an NIH K award to become trained in cognitive therapy at the Beck Institute, because I'm not a psych therapist, or I was a registered nurse and needed to become trained. So I got trained in cognitive therapy, but also schema therapy, which actually was a wonderful conversation. If anyone's interested in schema therapy, I'd love to talk with you about it. And then added in motivational interviewing and co-created with the women in my study a collaborative mapping technique that we used in this unique therapy program that I designed and tested. And it involved 2-hour-a-week therapy sessions. And that was on purpose so that we weren't cutting off the person like at 50 minutes saying, oh, I'm so sorry, can you stop right there? We're going to have to reschedule. You know, when you're talking about somebody who's finally gotten the courage to get help for their depression, and they've taken the step and they've come into therapy, the last thing you want to do is cut them short so that they walk away having a bad impression and never coming back. These 2-hour sessions actually were really, really successful. But I also learned a lot about how women understood what was going on for them. I'll tell you a little bit more about that in a few minutes. But basically, as I was going through all these different research studies and building my knowledge, I was getting clearer and clearer and clearer from the Latinas who I had worked with that actually Latinas who do enter therapy often experience positive outcomes. Not all the time, of course, not all the time. And there is that distrust. But there are many therapy programs that are successful, and we shouldn't ignore that. We should look at that. Also, stigma is a very personal issue. It's not a nut we can crack with the same nutcracker on every nut. Latinas often have similar feelings, but not always. But they often feel, I learned, that they felt they should wait until their kids, their family is taken care of before they get help. And stigma seemed to be very, very closely related to fear, not knowing who to confide in about how they were feeling, not knowing where to go for help, not knowing who to trust. And stigma was also connected with lack of reliable information and lack of insurance. So I started to narrow in on this issue of getting access to not just any therapy, but desirable, affordable therapy, and realized and got myself more versed in what were some of the barriers. Language, of course, came up. Cultural understanding was a big one. How much are people going to understand me, and how much am I going to feel a sense of belonging and acceptance when I go into that office? And of course, financial cost. I learned also that not everybody is ready to jump into talk therapy. You know, every small step counts, and everybody advances at their own pace. So here I was, gaining more and more information and realizing, okay, even though I just got trained in cognitive therapy and schema therapy, and it's really wonderful, I have to be honest and say that there are like so many LCSWs and MSWs and marriage family counselors and psychologists who are doing some really great therapy programs out there. So really the issue is getting access and offering access, and also helping Latinas overcome the barriers that are keeping them from actually doing the thing that they want to do, which is to stop feeling so crummy. In my case, my path led me to Transmedia, and I got this idea, why don't we use Transmedia for mental health? So I want to share with you a little bit of how that happened. I actually pitched an idea to my dean out of the blue that we should hold a symposium on the way Hollywood portrays nurses, because they have such a negative portrayal of nurses in so many television shows. And he challenged me and said, what would you do if you wanted to, and if you had the funding? I told him. The next day he got the funding. So I was in search of a film professor and researcher who specialized in the way nurses and physicians are portrayed in media. I found out about a UCLA USC conference. USC stands for the University of Southern California, a big university here in LA. Both have big film schools. They happened to be having this conference in March 2010. And I didn't care what the topic was, I was going. Well, it happened to be on the topic of transmedia. I didn't even know what transmedia was. Here in this circle, this is my husband, because I talked my husband into going to this conference with me, and I'm sitting right next to him. This man who's standing up and asking a question is blocking me, but up in front is Henry Jenkins. Dr. Jenkins he had just come to USC from MIT. He's considered the father of transmedia, a brilliant researcher. And he was discussing transmedia, and I literally, the light bulbs just went off, and it was a moment of enlightenment. And I said, of course, this is what we need to do for mental health. So what is transmedia storytelling? Basically, transmedia is storytelling over multiple digital platforms. So in other words, it means that a story can begin in like a television episode, a traditional television episode, but then the story extends to other platforms and other venues so that the fans of that story can access more media that is taking place in the story world with other characters, that tells a little bit more of the story or gives a different point of view on the story. And it really proliferated when, after 2007, when we all got access to these incredible smartphones, because that's when social media, of course, became big. And so using a smartphone, tablet, or computer, people could access web pages and videos on their phones, or other devices. And they were more likely to, if it was related to a story they saw on television that involved a character that they found likable and relatable, some story that attracted their attention and held their attention and made them want to come back for more. Just naturally, they wanted more. Well, this idea didn't come from Hollywood. It actually came from Albert Bandura. And I'm going to talk about him a little bit more and his theories in a moment. But Albert Bandura inspired Miguel Sabito, who actually created television shows in Mexico and inserted health messages very effectively. And this we could call entertainment education or edutainment. but it strongly influenced some transmedia productions, most specifically Soul City in South Africa, C'est la Vie in French-speaking West Africa, and Islos High, which aired on Hulu for 4 seasons through 2017. Each of these transmedia stories started with a traditional television episode that then spread to other digital platforms. And in some cases, for example, in South Africa, it also spread to radio, street theater, and also they did campaigns in schools and in community centers, using the characters' stories to enhance the health messages. So that's what transmedia is. I would say one of the most effective franchises of transmedia around today is probably Star Wars, because think of it. It started with a movie, but it moved from a movie to videos to comic books. You had action figures, so you could extend the story through playing with your action figures or setting them up. It also extended through fan fiction. We have writers all over the world writing episodes where they have the different characters doing different things. But then Star Wars split off into all kinds of other productions like The Mandalorian, and building on the original characters, have created a story world that just keeps on giving. Lots and lots of ways to tell more stories about more characters going through ups and downs and challenges and adventures that audiences want to consume. They're attracted because, and it all probably started because people related to Leia or Han Solo or Chewie or Luke Skywalker. So Star Wars is a great example, but we could talk about many Hollywood productions that use transmedia really well. But what about transmedia for health? So transmedia storytelling for health. Well, I launched myself on a journey to learn as much as I could about this. And I found a variety of different mentors and scholars and folks who could teach me. One was Nija Reinrich, a PhD in public health, who's doing a variety of different things in the world. But she talked about how we can change the world one story at a time with transmedia storytelling. And she pointed out how our brains are wired to respond to stories. When we watch a story, we vicariously experience the character's ups and downs. And if we really relate to that character, we often have an emotional experience, right? That's what Bandura's point is. And we learn from them and the consequences of their actions and their thoughts. These things that we learn and the things that we watch them doing can reinforce social norms, either for the good or for the bad, especially when it comes to health. So transmedia storytelling would be, as I've already said, with the example of Star Wars, you tell the story in a way that creates an immersive experience. But what we know from research is that if you make the story interactive rather than passive, if you make it interactive, it will attract and engage the viewers more dynamically, thus holding their attention. So because of the internet, what we can do today is we can use social media, YouTube. I don't know why this keeps clicking. Something must be touching my keyboard. I move this. Fan fiction, but also bonus videos that we on purpose design to give a message, and extra scenes. These are all other ways that we can cause a transmedia storytelling story to move off that original page, that original episode. So what my team and I did was we created, as Leo pointed out, Catalina Confronting My Emotions, Enfrentando Mis Emociones. And if you opened up your smartphone to the page of Catalina, it would look like this. This is just simply a screenshot that shows you what you would see. And we created this as it is, because of course we're testing it, because we know that it's not enough to just create a transmedia production that people say they like or that makes money because people watch it. We want to know if it really changes behavior, if it really changes symptoms levels, if it causes people to actually engage in making an appointment and showing up for an appointment for therapy, or with their physician to perhaps think about taking antidepressants. So the person who would open up our web app would see an intro button. And if they click on that, a 1.5-minute intro would give you an overview of what the whole web app offers. I'm so sorry why this keeps hopping. I don't know. Maybe I just won't use my mouse. The 1, 2, 3 leads you through the dramatic episodes that it's a dramatic episode with a bonus video and an extra scene, all showing us what happens in the life, sort of in 1 to 2 weeks in the life of Catalina, as she realizes that what she's struggling with is depression and anxiety, and makes the decision to go and get some help. And of course, her friends get involved, and there's some romance, and there's some tension, and there's some scary stuff that happens. And we have a beautiful soundtrack thanks to our Hollywood composer. So the tension mounts, and then it resolves as she realizes that she can actually get help and feel better and make better decisions. The person she goes to see is a character we named Veronica, and Veronica is played by Ureli Arizmendi. And Veronica, in her bonus videos, when the viewer would click on those, Veronica literally turns to the camera and breaks the fourth wall and talks directly to the viewer about Catalina and about the viewer. And this is one of those ways that you can play with the way stories are offered. And then Veronica explains how common depression and anxiety are, especially for Latino women, and how commonly women think, well, this is just the way life is, I just have to put up with it. She encourages the viewer to go on to use her interactive exercise that she designed just for them. And then to also check out her blog. And she says, I have a blog, you can click on it, and I have all this different resources, free resources that will help you get different kinds of help for your emotions. And in order to do this, I had to build a multidisciplinary team. And of course, starting first and foremost with Latina stakeholders themselves and Latina therapists and therapists who serve Latinas. I also had my transmedia experts. I had my Hollywood team, a Latinx director and script writer, Latinx actors. I had film editors, sound editor, composer, musician. I had to have researchers on my team and grant consultants, statisticians, because it was a mixed method approach. I had to have IT because we had to make this all accessible on a web page. And of course, funding. We had to go for traditional and out-of-the-box funding. What were we doing? We were creating an immersive experience to catalyze behavior change through relatable characters in a web app experience. And the storyline started with this episode. It had to be a storyline that worked for Hollywood, that Latinas would find compelling. And then I had to create these methodologies because everywhere I looked, some people were talking about transmedia, but they weren't saying, how do you do it? How do you create the scripts and the characters? And how do you create a web-based app? So first thing I did is I developed a methodology for how to get stakeholder input, how to identify a model, engage in good storytelling, and move through these steps here. Put the story parts where the audience is, provide interactive, dynamic opportunities so the viewer can become an active participant. And of course, I had to use research. And so the loop takes you through, and then it says repeat, because literally this is an iterative process. You don't just do it once and it's over. There's a lot of movement in this process. So for me, I had to get stakeholder input, and I did this through a variety of ways. One of the ways was to draw on my own research. This is a qualitative study I did with second generation Latinas about the experiences in depression therapy. So they were women who had gotten therapy, and then they spoke about what worked for them, what didn't work for them, and why. And this gave a lot of input about how we should create our characters. Of course, I had lots of data from a variety of different studies, and we drew on all of that to create our characters. We selected a behavior change model. In our case, it was Bandura, who pointed out that stories can be very potent vehicles for social learning because they evoke emotions, and the characters can become social role models. They can also, as role models, affect the way the viewer thinks and feels and acts. It can also challenge thoughts or judgments or misconceptions, and it could motivate viewers, says Bandura, to engage in behavior change. So viewers learn vicariously by observing the characters as they deal with the values and how they impact what the character does in the story. And as they watch the character act out expected rewards and social consequences of their actions. Then we engaged in this good storytelling. We had to have a compelling story arc. We had to have realistic, relatable characters, and it had to be data informed. I wanted to pull on our qualitative work to do this. And so our process starts here with reviewing de-identified data from previous studies. And then I'm going to try to move my mouse without clicking, develop data informed composite characters in a storyline. Then our script writer wrote the script for the episode, and then I teamed up with the scriptwriter and our Ureli Arizmendi to create the therapeutic bonus video scripts. We did casting and filming for the rest of the crew. We had identified Ureli early on. We filmed it, we edited it, we added the soundtrack, and then we did theater testing. And it's really important to do theater testing for people of the target group. That led to final editing, and then we had to load it onto our app. In our case, we cast Sandra Pera as Catalina. She is the 28-year-old lead character. And when we did qualitative research, what we found is that Latinas said they related to Catalina like she was a real person who had a past, present, and future of her own trajectory of her own life. And what they also said is that, well, what we could see from the data was that they would compare themselves to a time on their timeline, they would compare themselves to Catalina at some point on her time in relation to at some point on their timeline. They felt that she was emotionally vulnerable just the way they were. She had experiences like they did. And they specifically said, you know, she had to handle it and keep going just like I do. And they also talked in qualitative research after having seen the media that they saw Catalina as a springboard for imagining themselves, you know, taking steps to get help for themselves. So we published this paper, and you can find this online. I'm sorry, through PubMed. Some of this other stuff I haven't published. So if you do cite this and in the future, please cite this talk for that stuff, especially the methodology. But the fourth step in the methodology that I identified was that we had to put the story parts where the audience was, where they spend time. And we know that the Latinx community spends a lot of time on the internet. Latinas themselves have higher use of YouTube, Google+, Instagram, and Twitter compared to white women. So that's a good place to go. And we know they spend a lot of time watching videos and TV. So we knew we were in the right place with a transmedia production. I had to then team up with an IT team. I teamed up with Armin Arevian, a psychiatrist who's also a programmer, and he created the Chorus platform. His company is called Chorus Innovations. If you're interested, you can look them up online. But we collaboratively worked together with my research team, 3 bilingual bicultural Latinas, and we had multiple meetings to program and design. We didn't do the programming, but we helped design the interface. And because the platform actually not only hosts all the media, but it also sends text messages and it collects clicks, so we know what people have watched and how many times they've watched videos and etc. We knew that what we needed was the user experience had to have a desirable look. It had to be have a smooth flow, and that it had to be clear what the purpose of the web app was. And of course, this was to give access to these links to online resources and ways that you could get help but to sign up for an appointment for therapy. Number 5, we had to provide a dynamic interactive opportunity so the viewer was an active participant. And what we did is we created a way for the viewers. It's basically a 5-video sequence where Veronica talks straight to the viewer and says, I'm going to ask you some questions and you can type your answers on screen. And so she asks a question, and for the first one, you pick a number and then you hit next, and then she talks again and asks another question and you type in your answer, and it goes 4 times. And on the 5th video, she explains this is what your answers tell us about you. Your first answer tells us what's the biggest barrier in your life, and et cetera, et cetera. And we had really excellent feedback from folks. They really loved this aspect of the interactive module. We also created her blog, which is what Ricardo Munoz would call a digital apothecary. It's basically a way to access all kinds of resources in one space. These are screenshots that if I opened up the web app, you would see. We have buttons on the left. You see those blue buttons. Those will, if you click them, it will take you to one of the 12 categories of, 16 categories of resources, either available clinics in your local area, hotlines or helplines, zip code service locators, free apps that are specifically tailored for depression or anxiety, all kinds of infographics that have information about emotions, a website for free meditations, resources for domestic violence. And we have that all in Spanish and in English, depending on which version of the app you're using. I, of course, had to learn many roles to make this all happen. And then I want to just tell you about, I think I have about 10 minutes to go, right, Leo? So I can tell a little bit about the research?
Yeah, that's right. That's right. Yeah.
Okay, so we first tested it with 28 English-speaking Latinas, and they had to screen at 10 or above for depression, 10 or above for anxiety, either one or both. And we did the entire study over the smartphones, tablets, or computers on the Chorus platform. We had no attrition in this study. What we found was in 1 week of watching the videos, 39% of our sample clicked, called, or used resources to get help. 82% discussed the media with others. We had a statistically significant drop in depression at 1 week and another drop at 6 weeks. We also saw that taking action to get help was associated with higher levels of confidence and importance of how important it is to get help. At 6 weeks, as I said, we had a drop again in symptoms. 75% of the sample was still thinking about Catalina. This is really good, right? Because that means they want more. They're interested in knowing what happens next with her. Again, we see the association with confidence and importance. We did some qualitative work, and what we found is that the experience that the women had of the characters were like gears. First, they related to that lead character, and that got the whole process moving. Next, they met Veronica. Then they found her trustworthy as a nurse character, as a nurse therapist. That then turned the wheel of taking in the messages that dispelled old misconceptions. And finally, they found themselves preparing for how they could take action. So with this pilot study, we presented it in a number of places, and we published 3 papers. But then I immediately began work because we needed to upgrade. We had only tested our English version, and we needed to have a reliable Spanish version. So created, with the input of a variety of different mentors, a technique for translating the scripts and having a live table read to theater test, so we could create the Spanish version. And then we did a randomized controlled trial that was a pilot study, and we used Asgen's theory of planned behavior, hypothesizing that exposure to either the transmedia on the one hand or a control video experience on the other would affect attitudes, stigma, and self-efficacy, and that would then, a change in this would lead to a change in help-seeking behavior and symptoms. And what we found was, in most cases, that it did. We collected our data during the pandemic, not knowing that we opened our recruitment just weeks before a major surge in COVID-19 cases in Los Angeles and Orange County. It was basically the same model as the first study, except that this time we had a control group and randomization. We had about 20% attrition. This was during the pandemic. We did recruit 29 to the Catalina group and 27 to the control group. Our control videos were home activities videos. Now, at the time when we designed the study, we thought that would be sort of a banal, blank slate. That was just home activities videos, in Spanish, right? What could be great about that? Well, not realizing that people would be watching it during lockdown, eager to look for something to do, and home activities videos was exactly what they wanted. So we think that that did have an effect on them, but it had no story and no characters. So what we found is that of the Catalina group, 3 women dropped immediately, didn't look at any of the videos. So of the 26 remaining, all of them watched videos. 73% rewatched the videos up to 7 times within 6 weeks. This was surprising to us. 88% accessed the Veronica's blog with all those resources. Whoops, go back. 42% clicked up to 11 different links to resources, and 79% were still thinking about the videos at 6 weeks. Again, a very good sign. This is all with Spanish-speaking Latinas. We also used the narrative quality assessment tool to see how much people identified with Catalina and the story, and we found that they did highly relate to her, and that relating to Catalina was highly related to resistance to stigma, help-seeking self-efficacy, and self-efficacy to control your own, how much you think you can control your depression or anxiety symptoms. We also saw that the Catalina group had greater decreases in anxiety scores than the control group. No difference in the depression decreases between the groups. Again, we think that that might be because we kind of had a behavioral activation effect from those home activities videos. But we did see that 42% of the Catalina group versus 27% actually accessed treatment during the 6-week study. So we're really pleased with those results. There was also consistent increases in psychological openness, which is like attitudes, and decreases in stigma with a nice effect size there among women in the Catalina group. Now we're seeking NIMH funds for a large-scale RCT, and Dr. Cabasa is on our team. I am thrilled that he is part of our team as we go forward. We're partnering with Altamed, which has 60 FQHC clinics here in the LA and Orange County area. Clinica Monsignor Oscar Romero, which has, it says 2, but it's actually, they've grown. They have 6 FQHCs. Ventanilla de Salud at the Mexican Consulate, and Kaiser Permanente. And we are doing, we're recruiting 400 women, and we are going to do a RCT, but this time, instead of home activities videos, it will be just whatever videos are typically found on the web about mental health that would be reasonably identified by interested folks who were looking for information about mental health on the web. But what we'll do is we'll compile it into a control web app so that our control group gets access to that, whereas the experimental group will get access to the whole Catalina suite. In addition, to make it extend across platforms, the character Veronica will have her own Pinterest page and Instagram page so that they can continue the story by exploring that kind of media. We're also seeking funds to make 3 to 4 more episodes. Just want to point out that this kind of work takes an enormous team. These are most of the people who have been involved, but there are more, but it's at least a start. It's phenomenal to find great people to work with, and I feel very, very fortunate to have the folks on my team. And with that, I'm going to end my discussion and stop my screen share and open it up to questions about our web app and our research.
Excellent. Thank you so much, MarySue. That was wonderful. And it's great to see a research project where you need a Latin rocker to help you with sort of the music and this component. I don't think we've seen that in our services research.
Yes.
Component.
And are you familiar with Sergio Arau?
I am. No.
Okay, they had on, yeah, a rock and roll band from Mexico. Yeah, we needed music for the party scene.
Definitely.
Get it, right? So
that's awesome. So
yes.
If people want to unmute themselves to ask a question, you can do that. You can also put questions on the chat as well. And any questions you have for that'll be great. I'll start us off because I think this is an extension to me. When I learned about this work, it was an extension, and actually not an extension, a step forward in a whole other world of the work that we had done in entertainment education and fotonovelas, now really expanding this broader and having an impact not for help seeking, but also for actually delivering care, delivering some type of information and care in a way that reaches people where they're at as they're seeking help. So as to me, this was sort of a whole other process here to work. But I guess some of the work that you're doing here, MarySue, also thinks about in the stigma world. These are also processes that will help reduce stigma. You have a relatable character, a story that relates to people, that they can relate to that story and the person, and then you're modeling how to go about and seeking help and what people may need, which I think, as you mentioned earlier, there's a lot of lack of reliable information about the process of seeking care and mental health, particularly in the Latino community. So this is really addressing a huge gap in our communities, as I see it.
Well, thank you. I take that as incredibly high praise, and yeah, that was our goal, was to create something that women can check out, or they can watch it when they want to, discreetly on their smartphone, tablet, or computer. When it's private, they can watch a little, they can watch a lot. At many steps along the way, we of course did our theater testing, but I also would meet people from different agencies who were adding to our network and be willing to help, support our pilot work. And I would share the links with Latino women who were working and men as well, Latino gentlemen. But there were more women, admittedly. And what was increasingly encouraging to me was that they would get back to me and tell me what they felt about it. And so it was wonderful to get so much feedback, because people were not afraid to say what they didn't like, but it was overwhelming what they did like. And one of the main things was that they related to the character, and they found the characters easy to listen to, fun to watch, desirable to watch. And they asked for, interestingly, in our focus groups and in our target, in our qualitative interviews, as well as in the focus groups, people would say, well, I want to know what happens next, because there's my director, the Latinx director that I worked with, he told me, if you don't let me put romance in here and tension and frustration, I'm out. It's got to have that, because otherwise no one's going to watch the story. That's right. And so there is that. She's not fulfilled at the end of the first episode. She gets therapy, and she's getting clearer about what it means to look at some of the issues in her life, but she's not fulfilled. And they wanted to know, does she dump the guy? Does she finally dump the guy? Does her mom ever come around? Because a lot of women talked about how, unfortunately, their mom wasn't supportive for them. So she doesn't have a particularly supportive mom. And did she go back for therapy? And then other people, especially in our interviews, they just loved Ureli Arizmendi as the nurse therapist. She was so convinced. Of course, she's an incredible Hollywood actor who just really believes in the project. So she was really willing to be a part of it. But they found her, I want to go to therapy with her. Like, well, she's a Hollywood actor, right?
Yeah. But it is so questions, other questions for MarySue.
I have a question. Great stuff. I love the novelty of it. I think it's wonderful. But I have a question. With some of the populations that I work with, they're very rural, and they don't have a lot of access to the technology that it seems like this is relying heavily on. Or they don't have the bandwidth, or their technology to stream these the shows.
Mm-hmm.
Did you hear any concerns about that when you were conducting your qualitative groups or interviews? Did anybody express concerns about that?
No one did, Kelly, but this is a really important thing to struggle with. I met with a few program officers at NIMH, and in particular, it came up with one of the program officers. I'm trying to think of her name at the moment. When I do, I'll let you know, or I'll let Leo know to tell you. But at any rate, she's really concerned with rural populations and whether or not they can access stuff. I'm here in Los Angeles, and Latinxes have really high levels of smartphone ownership, and you can go to places that have free internet, McDonald's and other places that people are now more willing to go to, some libraries. So they didn't have any problem getting access. We didn't have any complaints of that. In rural areas, it almost would be like you'd want to team up with, if there's a library or an internet cafe somewhere, that you'd have to get really creative, because, or I guess what you could do is you could create episodes that people can download and watch that way, but they would still have to download it somehow. So they'd be a little more tethered, I think, to their desktop. I think this is probably going to be more attractive to people in an urban setting where there's lots of internet coverage.
Great.
And I agree as well. And I think one element of this that the technology, the access to the website, the access to the app, that's an important question and addressing that. But then this opens up the apothecaries, all these resources that may not be physically in your community, now you have access to. And some of them are treatment oriented. So it's not only information, but things that you can actually do in your home. And access it. So figuring that access is really important, Kelly, for sure. But the potential for reaching that population in rural setting, if that access is provided, then it opens up a whole other set of components for care when it's not there.
It starts to also really help us understand our colleagues who are out there advocating for, getting internet access to rural areas, how important that is. I mean, we know that I mentioned just very briefly that we presented this research in a lot of different venues. One of the places that we were asked to present was at the United Nations Commission on the Status of Women in 2018 in New York. And it was an incredible experience. But what I ended up having some very interesting conversations with people who, because they would share, the focus that year was on internet and digital technologies for women and girls. And countries that are working so hard to get internet access to women and girls in rural areas in their countries, because it is such an important empowerment and information and knowledge. It's a key to their health, but also to their well-being in many cases, where they may be just shut out of knowledge if they don't have access to the internet. So this becomes an incredibly important political agenda, not just here in the United States, but internationally.
Yeah. Other questions? Yeah.
I have a quick question. So thank you so much for sharing such an important study with us. So I'm interested in stigma and barriers related to mental health service use and ways to increase those access, particularly among Asian immigrant families. And I found the barriers of Asian American families are very similar to those of Latinx groups. So I was wondering your general thoughts on expanding this intervention to other minority groups who are experiencing sort of underutilization of mental health services.
Yeah. Well, I have, here at UCLA, prior to the pandemic, I teach advanced qualitative research methodology courses. And so I end up getting a lot of folks who visit my class or audit, and especially visiting scholars. And a group of Chinese scholars asked, when is it going to be ready so that we can dub it in Chinese and Mandarin? They wanted to do it in Mandarin. And, we want to try it, put us on the list. And I think that is fantastic. I personally absolutely love, I don't know how many of you do, but I love watching dubbed shows on Netflix from India, from Fiji, I've seen so many unusual and wonderful productions, and it's because of the power of dubbing. And so, you have to get the money, get the actors, get the directors, everything, because the dubbing has to be good. You know, you really have to have that ability. But, and I think some of the bonus videos might have to be recreated because they have to type on screen. Well, actually, you'd work with the IT department. You could do it. You could do it. But yeah, I think it's a great, great, great idea. It's one of the reasons why I'm pushing so hard for us to get this RCT so that we can show that it makes a difference. Because then the sky's the limit, right? It could be translated to any number of languages. And also other teams could do this. You could use transmedia for so many different things, especially if it's evidence informed. If you're creating the characters in the story and you're inserting messages about health that are pertinent to a particular group, it could have a diabetes focus or a high blood pressure focus or cancer care, or anything, especially anything that's stigmatized, anything that people are avoiding looking at or afraid to, but they're willing to do it discreetly. So stigmatized topics, I think, are very well suited to this. But I'm very eager to collaborate internationally or multilingually, even within the United States, if once we're able to show that it makes a difference. Thank you so much for your comments, Michael.
Thank you.
And MarySue, something that I don't know, I don't think you've published it, but the methodology, like the process of how you went about developing, because this is really capturing research, health behavior and communication theory with production, and it's a stakeholder engagement process for that. That is a real big contribution for people who want to replicate this work, expand it in other way, and use that methodology as well. Because I think that's a really important piece for further implementation and scalability of this approach.
Yes, thank you, Leo, and thank you, Dan, in the chat. I need to get that published like ASAP, like yesterday. But again, if you want to just cite this presentation, that is the material that I will be publishing is exactly those methodologies. And that, Leo, that was the hardest thing. I met incredible people. I worked with the people who created East Los High. I had the best fortune, but they didn't, they weren't researchers. They weren't doing it the same with the rigor that we would do it. And so I just had to develop it myself.
Yeah, and actually the story, if you go back to the story of entertainment education, that's exactly how it worked. You had the producers doing all this stuff, and it was until Everett Royer comes in and brings the researcher's perspective that then the methodology gets explained and disseminated for researchers. So there's a history of this process as well in that component. And it's funny that you got inspired at USC, because some of that work was done at USC for many years. So yeah, it's weird how the world works.
That's interesting. That is really interesting.
Yeah. All right, so I think we have time for a couple of more questions. Other questions?
I have a question.
Yeah,
okay,
yeah. Hi, MarySue. So this is all really interesting. It's the first time I'm hearing about transmedia and its use addressing stigma. But I'm just curious if you're looking at, what generation of Latino women this is most effective on, because I'm just thinking like this would probably work for someone that's been educated maybe in the US, whereas someone like my grandma who came here later in life would not be as receptive to transmedia.
Right. Actually, we did tackle that. So our last study was with 56 Spanish-speaking Latina women. All of the women except one were immigrant women to the United States. And most of them, I can't say for certain because we on purpose didn't collect a lot of demographic information. We didn't want to make them uncomfortable, but they were clearly educated outside of the United States. But you raise a good point. They were educated. Most of them, I think, were educated, went to school in Mexico or elsewhere. And they were very interested in it. They really, I never doubt the value of my work when I read their words in these transcripts, because they talk about how much it means to them. Of course, they point out what they would like to see differently too. But we then were very, very curious, because our PO at NIMH wanted us to open it up to anyone over age 18, but we didn't have any data from people over age 55. So we did a small pilot with 6 women and just did one-on-one interviews where they watched it and then they gave feedback. And surprisingly, what they talked about was, when I was young, I went through da 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 da. Or when I had my first baby, I had postpartum depression and I never told anyone. And so it ended up being that they were really interested. Now, our web app is really easy. You just hit the buttons 1, 2, 3, 4, 5, 6. In the real world, we would also want people to be able to have the freedom to go to Pinterest or Instagram or Facebook, but you don't have to. You can just watch the episode and then go straight to the web app or the web page and hit the buttons all in a row. So it could be a positive experience for people who aren't as savvy with tech. So I hope that addressed what you're asking.
Yeah, I was just curious to see if you were looking at that.
Yes.
Yeah.
Oh, yes, very definitely, because we didn't want it. We didn't want to agree to expanding it unless it was appealing to women over 55, Latinas over 55, and it was. So
That's
we'll
awesome.
we'll see, right? We'll
Yeah.
see, right? I would love to see a spinoff of the mom, right? The mom, let's hear her story. Why isn't she as nice to Catalina as Catalina would like? What has she gone through? And what was her relationship with her mom like? And so I would love to see spinoffs for the different characters as well, but it all depends on, first we have to show that it makes a difference, a measurable difference in behavior. And then of course it's attracting funding, though there are people who are interested in funding, but it's still a lot of work to work with philanthropy to get the money to expand, but it's well worth it. And I'm not going to give up no matter what.
No, and I think this is also, Melissa, to your point, it's like, where are Latinos of multiple generations, where are they seeking reliable information about mental health and mental health treatments? And actually, we don't have a good understanding of that media landscape and how people engage with that media. Because from our perspective, and actually MarySue's work, I think it's also pointed out, people are hungry for this.
Yes.
Because there's little out there that can grab on, that speak to their realities of their community in a language and in a way that relates to it, with stories that are critical. So I think that there is a huge amount of opportunity here to examine that landscape and how to then target it to different generations, gender, age groups, and things like that for that, because people are looking for the information.
Yeah. I mean, and I'd really love to also include men. I mean, there are men characters in the story, and it would be really cool to have episodes where it really explores the man's experience. And then I see, Aureli, your point there. Again, most of the women in our study, they weren't just immigrant women, they were undocumented immigrant women. Most of that last study I shared with you of the RCT, most of the women were undocumented immigrants to this country.
So I know we're at the top of the hour. Thank you so much, MarySue, for this presentation. This was great and exciting, and this work has always captured my imagination. And I'm glad that we're having an opportunity to work together on that R1 as it moves through the process. And just a reminder, our next seminar is October 19th. We're having Elliot Rivera Segarra present Addressing Mental Health Stigma Among Latinx, Lessons from Puerto Rico, who will be presenting some work that he's doing there. And after that, we'll have our next talk will be in November with Dr. Shields, a new faculty member from CMHSR and a new associate director of our center. So more things to come this semester. Thank you everyone for your time. We really appreciate it. And MarySue, it's great to see you and keep up the good work. This is great, and I love the collaboration that we've started. So
Oh, I'm so honored. Thank you, Leo.
all right. Thank you.